Good afternoon. I hope you're all doing well and socially isolating at this important moment in time. I understand this has been a period of immense pressure, discomfiture for the entire community. I can't really think in my own life there's been a time when there have been sort of more events that have pressed us in so many different ways, so many unfortunate ways as right now. Of course, we literally just came through or in the process of coming through a tropical storm, which we're used to, but I'm not sure we're used to them this early in the season. For the most part, it turned out to be less than we feared, but it also, I'm sure, caused great consternation. I hope you're all well in light of this. Also, obviously, we're facing the worst pandemic over the last century in the United States. And many people obviously have been personally impacted by this, or families, community. We're concerned about our own health and our neighbors' health and the community's health. And then finally, there's been a financial downturn, which itself is unprecedented in the history of our country. Unemployment has increased over the last few months, higher than it's ever done. Downturn in the economy, and institutions not only in New Orleans but across the United States have really been impacted. And of course, in the middle of that, the challenges to all of you, we've moved to remote working on campus, and everyone has felt isolated during this process. I understand, and we all understand how difficult this has been. That having been said, I want to say I've been so impressed by all of the employees at Tulane University and how you've really stepped up to the plate. Working from home is often not easy, but I think we've done it as a community with real aplomb. And what's most critical about Tulane University, it's not only the efficiency of what we do, but it's the culture, it's the service. And we've really been able to maintain that even though we've been apart, and even though we've been apart from our students and other members of the community. So I want to, again, start with a thank you for everything you've done during this period. Let me also note the university itself has especially in light of everything that's happened, done extremely well. I hope you've looked at our medical school and our hospitals and our research. They've truly been at the forefront. And especially in areas of research on COVID-19, we've been leaders in the country, leaders in clinical care, both in clinical trials, research on vaccines and treatments. It's really been extraordinary to see this. Financially, obviously, as an institution, we've been impacted, and that's led us to freeze salaries and freeze hiring and step back on a whole lot of different initiatives that we just couldn't move forward on at this point. At the same time, we've really weathered this certainly as well as, if not better than, all of the other academic institutions I've seen around the country that have really had to make far more severe interventions. And it's really positioned us well, I think, for going forward. It's very clear that our students very much want to come back. They want to be part of this institution. They want to be working with you and the entire community. And so it really is what we're looking at now is a process. We're envisioning students coming back on campus for the most part in 2 to 2.5 months. So there's a period before we'll be looking at ramping up before we actually come back fully online. And in that regard, we have a major advantage over other institutions in New Orleans. We've also had 6 committees working assiduously on thinking this through and how we can really come back in a really health and safe way. Let me note those committees have, in a sense, been guided by 2 principles. And the first is the protection of the health and safety of the entire Tulane community. We have the advantage of some of the best minds at the medical school on issues of transmission of infectious disease, testing, tracing, all sorts of different ways where we can really get, I think, up to date, the best advice about how, in a sense, to create optimized safety on our community. We also recognize there are particular individuals who may be more at risk, and we've been thinking through all the different ways we can provide protection for individuals, and as well as continuing working from home where that makes sense in terms of the job. We've also recognized, quite frankly, the importance of what we do at Tulane, both in research, in terms of education. Our students desperately want to come back to be part of this community. And given the state of the world, they will truly be the leaders in envisioning how we respond to this pandemic. And in a sense, this has often also been brought forward by all the terrible events that have occurred over the last 2 weeks. I do want to take a moment to honor the lives of George Floyd, Breonna Taylor, and all the people who we've seen lives have been tragically taken away from them. Last week I made a statement to the community about my personal anguish at seeing what happened, but I also thought it revealed so much about our society and things we need to do as an institution. I stand with the Black staff and faculty and students of this university, and we have to figure out ways to do better in what we do on campus and do what we do for the community. And I'll be coming out with a statement soon about some of the things that we're going to move forward on in that regard. But again, it brings home the importance of us coming back on campus. As I say, the plan at this point is we will start classes on August 19th, and we will have a very concentrated semester. We will not, in a sense, have any breaks until Thanksgiving. The purpose being not to create circumstances where students will be traveling at great lengths from the campus, which we think is the greatest risk, is when they travel around the country. And we would, in a sense, end the semester at Thanksgiving, and they would take their exams remotely. In terms of employees, we've started the process of thinking through how to bring employees back, and in a second, Shante Bolton will give a little more concrete outline to that. But the idea fundamentally is to only bring employees back into a very safe environment, a socially distant environment. We're looking at, in a sense, creating an environment where everybody, as they come back, whether they're students, faculty, staff, will have been tested as they come back. And that's a large surveillance testing. We will obviously covered by the university, so that in a sense, there's a broad understanding that individuals who are part of the community have been tested, and we will envision continuous testing on the campus over time, surveillance testing, so as we can identify anybody who may have picked up COVID-19. As you know, large percentage of the cases are asymptomatic, so it's very important that we engage in this type of testing. We'll also obviously be asking everybody to test their temperature and recognize if they do come down with it. We'll immediately test them and ensure that they are isolated. There's a broad program to not only clean the facilities across the university, but socially distance. We're going through all bathrooms, all spaces, looking at them to make sure there's a distance and that they're cleaned on a rigorous basis as part of that. That includes classrooms. We're actually having 6 new classrooms built on the campus for this period to create larger environments for the classes, so no students take classes in a class that's concentrated. Literally all classrooms will be at least twice as large as what is normally expected for the class. We're also building another dining facility right next to the Commons. We moved from Bruff with 450 tables to the Commons with 1,100. And we're going to expand that as well so that everyone can eat in a socially distanced environment. There's also a long program in terms of the dorms. We're deconcentrating the dorms, providing more options for singles for students, and we can go into that if you would like in the Q&A. We have a variety of leadership who've been involved in formulating these plans. It's still a process. Over time, we're taking advice, suggestions, continuing to talk to experts about this. But they've all been deeply involved. So I just want to introduce them. I think you know them all, but there's Robin Foreman, the provost, Patrick Norton, the chief operating officer, Shante Bolton, the deputy chief operating officer, Jason Cretion, who's head of HR, Human Resources. We have Kelly Venable Carroll from Facilities Management, and we have Scott Timms from Campus Health, all available to answer questions. Before we turned it over to those questions, though, I wanted to give Shante an opportunity to give a little more outline to this process of bringing employees back over the next 3 months. Shante.
Thank you. So we recognize that it is critically important to devise a return to work plan that will allow us to gradually increase our staff presence on campus. And we've elected to do this through a phased return to campus approach, ensuring that there is a thoughtful and flexible approach that we take to meet the needs of our students, individual personnel, as well as the operational needs. And as President Fitz stated, the goal is not to return everyone at once. Instead, we want to look at this in a very measured and thoughtful way. So what we've charged the senior leaders with is to work with their leadership within their units to assess and determine which operations must be resumed on campus and in what order should they be resumed based on the latest guidance that we've received from local, state, federal government officials, as well as public health authorities. So a high-level overview of the 3 phases that have been proposed by the COVID-19 task force include, with phase 1, the targeted dates are between May 18th and June 30th. And there's a continuation of current infrastructure and critical services and research support. This includes entities such as student health, reduced but a footprint of student affairs, OEHS, clinical, public safety, and healthcare employees. Also, there is a presence of operations and facilities such as dining, grounds, and even housekeeping, because these groups are helping us to prepare to receive additional employees, also supporting current community needs. And then in phase 2, we are looking at the targeted dates between or around July 1 through August 19th, which is the start of the fall semester. That would include an increased presence with departments such as Information Technology Services, increasing the number of staff in student affairs, in student health services, and additional research support units. The final area for phase 2, we're looking at our critical on-site academic, administrative, and business operations. And this will all be decided by the unit and school leadership. Phase 3, the target dates for those is August 20th through September 15th or after, recognizing that we may have to extend the remote working depending on what the nature of our environment is with COVID and other factors. The remote working for some units may extend possibly into September or after, but there'll be a continuation of increasing the staff in the academic, administrative, and business operation areas in full or to perhaps limited capacity, but it will be working in conjunction with leadership and using those guidelines that we're getting from local, state, federal government, and the public agencies. I do want to make a note here before I pass it back to President Fitz, in that these dates are general targets. They are subject to change based on the changes that come from these various government entities and public health. So I don't want people to get stuck on that as a fixed date. We're working with leadership and we're trying to actively engage and based on the needs of the unit as well as the needs of preparing ourselves to receive our students. Again, the phases were established to just enable a safe and thoughtful approach to the increased campus operations over the summer, but also as we prepare for the return of our students in the fall. Departments will have the flexibility to adjust based on their departmental and positional needs. President Fitz?
Oh, thank you. Thank you, Shatay. I should note that before employees are brought back, we are looking at the spaces to sort of ensure social distancing in the space. We're looking at cleanliness, we're looking at plexiglass, all the different ways when employees are on campus that we can ensure to optimize their safety. And obviously in some cases, working remotely where that's part of the ability of the position, we will definitely explore that as well. So that's sort of a general outline. I know lots of people have lots of questions. I wanted to turn it over to Carrie Stockwell from my office, who is going to be reading those questions to be answered. Carrie?
Sure, and anyone can submit a question using the Q&A button at the bottom of your screen. The first question is about salaries. In the past, during periods of financial constraints, Tulane continued to give salary increases to employees who made under a certain dollar threshold. Is the administration considering this approach during this crisis? If not, why not?
So we certainly thought really long and hard about this, and it was not just freezing of salaries, but it was also the hiring freeze as well, and also the changes to discretionary spending, right? So we needed to take quick and decisive action, and we did, around how to ensure our financial sustainability going forward. And as the president said earlier, we are actually in better shape than a lot of institutions out there by the decisive and quick action that we took. So as of this point, there is certainly three things that we're doing. One is scaling back on our discretionary spending. One is we have a hiring freeze. And lastly, we have a salary freeze for merit salary freeze for all employees, and that is our position. And certainly at this point, we are certainly not changing it. Full stop.
I should make a comment that I understand the pressure everybody's in at a time like this. I think if you look around at other institutions around the country, not only for-profit institutions, but universities and nonprofits, they've had to make far more substantial cuts than we've had to make. Our goal is to preserve literally the position of everybody as part of this institution. And we, as you know, several years ago, we did a lot of structural changes to improve the financial position of the university. I think they've put us in a better position now than we otherwise would have been. And we're trying to keep, in a sense, to preserve the positions and salaries of everybody part of this university.
The next question is about the staff calendar. What does it look like for the upcoming year? Will it change in response to the academic calendar changes? And does the lack of breaks include the fall semester like holidays such as Labor Day or Yom Kippur?
So I'll start off, and Jason, if you want to jump in, feel free to do that. But there will be a communication going out tomorrow morning, actually, to give you all an update on where our 2020-2021 university calendar looks like. And that does include the observation of Labor Day. But we don't observe Yom Kippur in the university calendar. However, we are working with units, as we have in the past, that they will support the operations around any academic holidays that are observed to ensure that the students do not experience any disruption in the support that they need. Jason, is there anything you'd like to add to that? Or?
Yeah, I just wanted to highlight that one thing that employees will see when the holiday calendar is distributed is the resumption of a floating holiday to be used at their discretion. So keep your eyes peeled. There'll be more information coming out about that, but just a little teaser there.
Next question is about testing. How will testing for employees work? Is there a copay? And what if I don't have Tulane's health insurance plan?
Can take that. So our plan right now is to have 2 different testing centers, one uptown and one downtown, that would have hours, and then we would be working to do blocks of testing with areas on that, and being vague because we're still working out the details of how that will work and sort of what the flow will look like. The university is covering the cost for tests. This will not be run through your health plan, and there would be no out-of-pocket expense to the employee going in for that purpose. And just to also add, because I think there's some confusion, we're doing the PCR test, which is looking for whether or not you have COVID right then. We will also have serology testing available. We're still working out the details on how and who would be eligible to receive that. But we should have a very comprehensive testing program available and connected both on the front end and the end of the actual testing piece. On the front end, we'll be asking people to do a daily check for symptoms. And so anyone who has symptoms would actually have a different sort of path to go for testing. So you could be evaluated for COVID versus someone who's just going for our surveillance testing. At the end, we would also have contact tracing. So if we have anyone that has symptoms or has been in contact, we'd be doing notifications around that. So again, testing will be very complex and complicated, but we hope to make it as easy for you to access as possible.
And Scott, just to jump in, so this is really important, and I'm really happy somebody asked a question because it's foundational to our work keeping our campus safe is testing. So we'll be doing baseline testing of all individuals as they come to campus, and that's going to be students, faculty, and staff. So all 20,000 folks will be tested. And as Scott said, also we're going to be testing for antibodies as well. We have to work out the details, whether it's going to be concurrent with the PCR testing or not, but we're going to be doing those testing. And it's going to be at no cost. And the whole point is to make this, there should be no disincentive, right? No disincentive for folks wanting to be tested. So we want to make it easy, as Scott said, and we're figuring out the locations. There'll be one uptown and one downtown, but we also want to make it easy for folks to go through. So stay tuned for more on this, but we're going to have testing sites on both uptown and downtown campus. Full stop.
Just one follow-up comment. Again, let me underscore, the purpose here is to support the safety of the entire community. And the safety of the entire community is a result of everyone in the community being tested for COVID-19, so that you can have a certain degree of more sense of security in that everyone has been tested. And we're talking as you come back, but also over time again. I should note the test we're intending to use is not the invasive test that you've heard about. It would be far less invasive. It's in your nostril or maybe saliva. We're not decided on that. One final note: Scott and Patrick are enmeshed in the terminology. The surveillance testing is to determine whether or not somebody now has COVID-19. Antibody testing is for people to determine whether they had it, whether they have the antibodies. So it's still in the beginning stages, but it gives you, it may well give you an indication that they have a degree of immunity from COVID-19 because they had it in the past. Gary.
We received several questions about returning to work, questions about whether there will be options for combined work at home and on site. For those who are working from home successfully and would like to continue, will remote work be considered as a long-term option?
Yeah, I can jump in on that one, and Shante, please add. I think the answer is yes. I think we're all learning. I think we're all learning through this process, right? I think we all kind of had to jump in. Some of us had to jump in the deep end of the pool around remote work, and for some it's working. And I think the key is to work with your supervisor, but it's got to be effective. It's got to be effective work, and I think that's working with your supervisor, working with your unit head, and of course working with your HR business partner to come up with a good model. I think is the way to go. But I think not just Tulane University, but a lot of workplaces are rethinking, of course, the role of work and how remote versus on-site is going to work in the future. Jante?
As emphasized when I spoke earlier, we want to be flexible. However, that flexibility has to be tempered or calibrated with the needs of our students as well as our operation. So most employees will return to campus by the time we get through phase 3. However, we understand and are open to the flexibilities that may be needed, and employees are encouraged to work with their supervisors who, in coordination with HR and where needed, the ADA coordinator will look at what flexible arrangements we may need to extend. Now, those flexible arrangements, I just want to be candid, are not intended to be a forever indefinite thing necessarily. We have to look at what the position duties are and how that relates to their ability to function in a remote environment. But some employees may be permitted to continue to remote work arrangements through an extended phase and returning to campus. But this would also involve periodic reviews of their ability to return back to campus based on the individual position. So I just want to make sure that we're being as transparent and clear on what that looks like. Obviously, through COVID, especially if there's any resurgence in the fall, we're going to work with our employees to make sure that your health and safety is of paramount importance and a priority. But we also want to make sure that we can support our student needs, our faculty, and the community in which we serve in our respective roles.
In the same vein, we have questions about expectations of returning to work for those who have childcare issues or delayed school start times, if there are any issues with school closures or delays. Can you speak to that?
Yes, so all concerns are going to be evaluated through an interactive process in conjunction with the employee, their supervisor, the HR business partner, and as I stated earlier, where necessary, the ADA coordinator. We understand that there are some challenges with childcare throughout the city, and until the schools start back in the fall, we will work with employees through the summer accordingly. So I guess the best way to answer that is that we're going to be flexible. We need to know you are not required to disclose a health condition to your directly to your supervisor, but we encourage you to talk about what concerns you have. But as it relates to childcare, you do need to let them know that so that we know the differences in how we're going to triage and work with our employees. We're also actively in the background looking for resources. So we're trying to keep a temperature check on what facilities may be opening up, what services are available, and trying to think about how do we help our employees to be able to access the childcare support they need as it becomes available. As you know, the city and the state are moving at 2 different paces in terms of moving from phase 1, 2, and so forth. So we're watching it, we're monitoring it. We're going to work with you to make sure that you have what you need in terms of support, but as we gradually work folks back to their regular work location.
We had a question just about clarification as we're speaking about this. Are we only referring to the uptown campuses when we talk about employees returning to work, or what about downtown? Is this included in the returning to work plans?
I think we're talking about both uptown and downtown.
Yeah, and just
now it's a little obviously when you're talking about the hospital, you know, and some of the research labs in the medical school, they've never closed. So starting up again looks a little differently, but we're talking about both uptown and downtown.
Yeah, it's never been really that clear. I mean, we have the Primate Center on the North Shore that never closed. School of Medicine, as the president said, closed a little bit, but not much. It's really, you know, and yeah, it's mostly the uptown campus, but it's also the remaining areas downtown as well. So it's really all campuses.
The next question is about health and safety in the office. Will employees be required to wear face coverings when we return to work? And will plexiglass be provided around reception areas to prevent COVID exposure?
Yeah, there'll be
Dr. Eubank,
rules. There'll be rules, clear rules on face masks, face coverings when you're in the office, and certainly if you're in a single office with your door closed, really no need to wear a mask. Or if you're, I mean, so there'll be certain guidelines on how you wear your mask and where you wear your mask. But the plan is for everyone to have a face covering when they're in certainly public spaces, for sure. Yes.
Yes, if I can add to that as well, I think it's important that we remember when I was growing up, my grandmother used to say it takes a village to raise a child. And I think in this instance, it takes a community to combat the impact of COVID. And so we all have a personal level of responsibility in this. There will be some administrative controls that we put in place, such as policies around face coverings and also social distancing, how we engage one another in the workplace moving forward. It'll become our new normal, but I believe that through mutual respect of each other as fellow employees and our shared desire to keep our campus safe, we are trying to make sure that those administrative controls are not burdensome, but there will be an element of personal responsibility and accountability that we really need everyone to be a part of so that we can ensure the safety of all.
Kelly, I wonder if you could make a comment about sort of the facilities and the efforts both to clean and improve safety of the facilities around the campus.
Absolutely. So one of the things we've done is we've retained JS Held, which is a global leader in industrial hygiene and environmental health and safety. JS Held is working in conjunction with our own university industrial hygienists to write protocols that we will use to sanitize our buildings prior to everyone coming back. In addition, they're also assisting us with writing the daily cleaning protocols that we'll use throughout all of our campus buildings every day. And that looks like increased cleaning of your high touch areas like door handles, elevator buttons, handrails, counters, you know, a lot of the things that you would see touched in any common areas around the university. JS Health's also working with us to assess our spaces. So there's a team of us that's going into every space on our campuses. We've spent the last 2 weeks, we've tackled most of the Uptown campus, but we're doing housing, we're doing dining, we're doing general pool classrooms, we'll be doing labs, we've done childcare, we'll do Riley athletics. I mean, we literally are going to be touching every space within our campuses to make sure that we have the right protocols in place to welcome people back safely. We will be adding wipe stations, sanitizer units. We'll be installing plexiglass where it needs to be installed, particularly in those frontline customer service areas. And just making sure that people feel safe coming back. If for whatever reason we get into a space and there's physically nothing we can do in that space, whether it's we rearrange the furniture to allow for social distancing or we can't put plexi in, we will definitely be working with Shantae and her team to accommodate and, you know, come up with some sort of administrative protocols that can be put in place. Because at the end of the day, we want everyone to feel safe about coming back to our facilities.
Kelly, we have a couple questions about Riley and food options. When will Riley reopen to staff with memberships? And also, what food options will be available for staff?
Right now, as far as Riley goes, they're working off of a phased approach following what the city's doing. So right now they're obviously closed, and when they come back, it will be very limited on what they can do, because when you think about socially distancing, obviously when you social distance in a classroom and an office, that's going to be a much smaller space than if you're working out or if you're doing theater and dance, because you're exercising and you're breathing heavier. If you're in theater and dance, you're going to be projecting. And so the amount of space that people need to be in a recreation center is going to be greater. And so that will limit the amount of people who can be in that space. So we're looking at, you know, what that looks like in phase 2 and then in phase 3. So later this summer, we can't give you hard dates because we're waiting on city, state, and state fire marshal protocols to come back. You asked about dining. So on the downtown campus, we have added some food trucks in addition to the cafeteria that's already open down there. And then the Uptown campus, we have all the regular food offerings that we've had over the last year, but we'll also be implementing some additional mobile options. So maybe it's grab and go from a concession stand in Devlin, Fogelman Arena, or we'll have maybe some more food trucks available. We're looking at concession stands within the athletic complex. So just lots of different options that we're looking to identify. We're also activating more outdoor spaces. So we've had a lot of outdoor spaces already, but just making sure that we have the right furniture and we also have the right Wi-Fi, so that if for whatever reason someone doesn't feel comfortable going into class, they can at least go to an outdoor space to log into their classes or just be able to drop in and study.
I think what's important to keep in mind is we're still a couple of months away from full reopening when students are back. So we're working through a lot of these options, right? So you can imagine a world in which, you know, we do provide staff options for dining outside. There might be an opportunity to do that in addition to everything else that we're looking at doing with food trucks and concessions. So it's a little bit of a work in progress as we work through the next couple of months. We got a lot of smart people working on it. We have Sodexo, who, if you think about it, this is their business, right? And they need to bring all their customers back back in business for dining, certainly across the country and really across the globe. So there's a lot of smart people thinking about how to bring dining back, and also how to provide dining options for our employees as well. Full stop.
Just two notes. One, I think it likely we will limit access to Riley to only members of the Tulane community, given the need for social distancing. And as I noted before, we're building another dining facility, a temporary dining facility next to the Commons, which will increase again the number of socially distanced spaces on campus for people to eat. We go back to Bruff, that was 450 spaces. The Commons had 100 spaces, and we'll be adding another 500 or 600, I guess, with the this new space. So we're trying to expand dining options, and of course the outside options are also excellent.
So that's going to be, so as already understands, it's a temporary space that we're building. And we're building a temporary space, and we're also building some temporary classrooms as well on the Berger family lawn and also on the Monroe Quad.
There's a question about Sodexo employees, how Tulane is ensuring their safety. Will Sodexo employees receive regular testing and paid sick leave to help minimize risk?
Well, on the testing side, yes. The answer is yes on testing. We're going to include them in our testing regime. For sure. And if you really think about it, food service, even pre-COVID, they've always had to adhere to very, very high standards around health and safety, right? So they've always been, gloves and the like, and healthy cooking and safe cooking. So I think they're far ahead. And then this is just another overlay around COVID to ensure that they're physically distanced and also wearing masks as they're preparing the food. And engaging with their customers. So certainly from a safety standpoint, I think they're in a great position coming in. I think Sodexo is going to have a great playbook on safety, and we're going to provide some testing protocols as well for the Sodexo employees. As far as the sick leave and standard benefits, that's provided by Sodexo, and I think we feel really good about how they provide those. Full stop.
A question about the confidentiality of COVID testing results. Will those results be accessible to managers or others on campus?
I can speak to that. We would not be making those results available to anyone on campus. They'd be housed within an electronic health record system that we manage, and would be limited to healthcare providers on a need-to-know basis. But also say that privacy around that is extremely important. We're a HIPAA-covered entity, part of the university there, so it wouldn't be shared. It's also true in regards to contact tracing. If we find out someone's tested positive and then we're notifying people who may have been exposed, we won't be disclosing who might have exposed you. We would only let you know that an exposure occurred and that you would need to get testing access. And again, that would all be treated under extreme confidentiality.
Scott, if I can add to that, just so that everyone on the call knows that we already have policies in place prior to COVID to protect the confidentiality of healthcare information. That's a standard practice in our existing policies, and we do not plan to compromise those or to change them in this instance.
There's a question about risk assessment for our campus buildings. Are these risks being assessed by building? For example, Elk Place shares space with the Downtown Student Health Center and a shared parking garage elevator with the hospital and cancer center. Also, what about sanitizing buildings that the university doesn't own? For example, 1555 Poydras.
Yes, so the assessments we're doing are taking into consideration all of these shared use spaces and what's happening in the spaces, because obviously everything we do is interconnected in some way, and we need to take that into consideration. High-rise buildings that we don't own, or any leased spaces, quite honestly, that we are working with those owners to determine what their standards and protocols are going to be outside of our spaces. And then if we need to do anything additional in our own lease spaces, we will do that.
And Kelly, just to jump in for a second. So these forums are great to get feedback. And I think that's a big part of this is for us, well, for us to inform, but also for us to get feedback back from you. So if there's a space that you think is that's a concern that you think we may have overlooked, please get to Kelly and she'll get it into the really the plan of action. We're going to go through every space on our campuses to assess and then get them ready for the return to work. But you know, we may have missed something, we might have overlooked something. It's very possible, or you may be seeing things a different way. Please get that information to Kelly and she'll take a look at it.
Yeah, thanks, Patrick. Let me clarify. So when we go through and we do assessments, we're not just doing it on our own. We're doing it with the consultants and our own university employees from emergency preparedness, OEHS, and campus services. We also are walking through with the department administrators and members of the department. So we send information ahead of time that lets the department administrator know specifically what we're going to be looking for or asking for feedback. So if there are areas that currently give you some heartburn, we want to know about that prior to the assessment, because we want to make sure that we're really looking at those spaces and taking that into consideration. So I didn't want you to think that we just went in and in a vacuum we were looking at these spaces, because the assessments are done in conjunction with the facility manager or the departmental administrator.
1555 is a good question, because we obviously have huge spaces and we're going to be going over all of the spaces in it, but the building itself is not our building, and we need to be absolutely sure that the spaces our employees are using in that building are covered by that.
And there was a question asking whether the university would provide cleaning materials for spaces where the cleaning services don't typically service, certain laboratories, et cetera.
So what we're doing as part of the assessment is once we do the assessment, then we will work with the department administrators to identify what their needs are, because obviously there are things out of the university's responsibility. So as we are adding in these dispensers for wipes and sanitizers and stuff like that, that's ours. That's on us to change out and refill as needed. But we will also identify what's going to be departmental responsibility, and we will work with you to make sure that you get all of that ordered through our purchasing department. We're centrally procuring all of these COVID-19 products through Michael Dernbauer and his team. And then obviously there's individual responsibility as well. So, you know, working with your department administrator, if you want little individual pumps in your office or, you know, bring it from home, that's going to be up to you. But we will identify what's individual responsibility versus departmental versus institutional. And we will work with you to make sure all those things are done. Plexi, we will make sure that we hand you off to someone. We have outside contractors that are coming in to do the plexi. So they'll come into your spaces, they'll measure everything, make sure it's going exactly where it needs to go, and then we'll get that installed. And once you've notified us that everything's been ordered and your plexi's installed and all the controls are in place, then we'll come back and we'll reassess your space to make sure that everything is where it needs to be. And then we'll sign off and say, okay, you're safe to re-enter now.
We have a question about visitors to campus. Will there be limitations to visitors, campus tours, speakers? Will we remain an open campus to the broader community?
A great question. We're not literally going to put a fence around the campus, but I think we are intending to reduce the number of people coming from outside. And that, you know, we're not going to be renting out the space in the LBC or other parts of the campus to outside groups. We will be limiting groups, you know, any group coming on campus. We are not going to have the same relationship with Loyola we've had in the past, where Loyola students could use the commons and other eating facilities. Loyola students will remain on Loyola. Tulane students at Tulane. We do want to limit the amount of number of individuals coming on the campus from the outside. As I noted, we're truncating the semester, starting a little bit earlier, because we want to minimize the number of times our members of our community travel around the country. We view that as the greatest point of risk. We also want to reduce the number of people coming on our campus for that reason. Obviously, we're testing everybody who's literally part of our community. We can't literally test every single person coming on the campus, but we do want to limit it.
Yeah, Mike, just to add, so we have, of course, our employees, and then we have our contract employees, which is basically Sodexo for the most part, for day-to-day operations, food service and custodial. They're going to be part of our testing model. They'll be included in our testing model. Then you have contractors that are short of time and really in one location. They don't move throughout the campus, and that's our construction workers, right? So we're going to ensure that the construction workers that come on our campus are, they're safe, but they're not being mingling with the rest of the community, which is what happens now for the most part. Is they stay basically the construction site. They go back and forth to their car, but they don't come on the campus. We're going to have to really be religious about those principles and ensuring that it happens, because we will have construction on our campus in the fall and the spring. So we're going to have to ensure that those individuals really stay to the construction site and to their vehicles, as opposed to being on the Berta campus.
We have a few questions about the COVID leave. Are you anticipating changes to sick and vacation leave for staff beyond the initial 80 hours of leave offered? If staff or their family members are diagnosed, will the leave still be available, or will it expire at some point?
Excuse me. At this point, we don't anticipate adding on additional hours, if you will. The original 80 hours will remain available to employees who have not used and may have a need to use. We also understand that as a result of COVID and any possible outcomes that may be forthcoming, whether that's quarantine while testing is being evaluated, that we don't want to negatively impact employees. So we're dealing with these cases on a case-by-case basis to ensure that we do not adversely impact any employee as a result of COVID.
Also, a question about employee benefits. To combat any financial issues, will there be changes to employee benefits like the child tuition waiver?
There are no plans at this point to change tuition waiver as a benefit.
And we strongly encourage you all to still utilize the benefits that are made available to you, but there's no conversation or plans to impact those benefits.
Correct.
We have a question about sporting events and other large events on campus. Are we having sporting events or weekends like homecoming? What about large events that usually happen at night and members of the public attend, such as lectures, presentations, performances?
I think this is all a work in progress. As you know, the city has said there shall be no more festivals throughout this calendar year. They haven't defined what a festival is, but clearly extraordinary large gatherings of people are not going to be allowed. At one point, Mardi Gras Jazz Fest was going to be in the fall, and that's been delayed. We are in all of these cases subject to the restrictions of the city and state about gatherings and how large a gathering. The numbers of people who can gather has been increasing, but I must say that the thought of 25,000 people congregating together in Yeoman Stadium is certainly less likely than you would have thought in the past. You know, gatherings of that size, it's hard to see them occurring this fall. And they're related type gatherings, whether it's be Parents Weekend or other events that clearly will have to be done very differently. We're thinking through at this moment, convocation. You can't envision bringing together 1,800 students together. It will have to be done dispersed and remotely. So we're thinking through, I think, all these different issues. And again, it's subject to recommendations by the city and recommendations from our own medical staff. I should say there's one question, a separate question about whether we can have fans watching athletic events. There's a separate question of whether we can have students, athletes playing in those events. Separate issues, but I think the entire country is grappling with the question of, can you have a football team playing football and socially distancing? And there are lots of plans about testing the team and testing everyone on the team before the game and after the game and so on. Again, in all of these cases, it's we're working through those issues, again, with the fundamental principle of keeping, optimizing safety.
There's a question about the Tulane shuttles. Will there be any changes in the access and policies of the Tulane shuttles in regards to social distancing?
Yes, so we're currently working through that right now. We're looking at 50% capacity on our shuttles, and then obviously that changes as the city and state change their phases. As far as will you have to make a reservation, haven't gotten there yet, quite honestly.
The point is, we have to ensure social distancing on the shuttles themselves. So there have to be fewer people on a shuttle. They have to be more and more frequent as a result of that.
Yeah, also, Kelly, it might be good to look at the RTA policies around this as well as the city opens up, right? Whatever the RTA is using around their buses, we probably should look at as well.
Can you talk about plans for the on-campus childcare centers?
Want me to take that one, Patrick?
Kelly, yeah, Kelly, take that one.
Sure. So we assessed Newcomb Children's Center last week, and we're going to be making those recommendations to them next week about all the different things that they need to do to get their school in order. And we are looking at an opening sometime in July. Obviously, that is all dependent upon getting supplies in and the things that we need to get their space ready to receive the children back. Kiddopolis is outsourced, and so we are working with that provider, Bright Horizons, to get their spaces assessed and all ready for the children to come back as well. We're trying to get the spaces opened at the same time so that we don't have one opening in front of the other one.
So just to jump in here, I mean, we know how important two things are, right? For a reopening, one is pre-K, early childhood education in those sites, and also public school as well. So certainly on the early childhood side, as Kelly said, we're working really hard to make sure that we're open. I think we're targeting July 15th thereabout to be open with our child care centers. But you know, so trying to socially distance with a 3 or 4 year old is not going to be the easiest. But we have folks working really hard on that.
Question about the phased return to work. Will there be guidelines sent out to supervisors about the phased return?
In short, yes. You will notice there's a website in which a lot of recommendations were provided, came out and was highlighted in President Fitz's letter a week or so ago. But those recommendations do include formal training, support with checklists, and communications with supervisors. We recognize that the supervisors have to work to ready the environment and also to be able to anticipate or field some questions or concerns that employees may have. So we are working to make sure that they have the support that they need to be able to return their employees back to work. Jason, if you have any more specifics in terms of what HR is working on, feel free to add.
Yeah, I was just going to add that in addition to the supervisor resources, we'll also have resources for the employees. As Kelly reiterated earlier, there are multiple roles, if you will, as we return to campus, that of the individual, the supervisor, and that of the institution. Our intent is to have collateral available for the supervisor and the employee groups as we begin to ready their workspace for their return. Full stop.
Okay, I think we have time for two more questions. The first is, does the hiring and merit increase freeze include a freeze on promotions?
The answer is no, but those will be, those will have to be exceptional, right? So I think we had discussed that in the memo way back when. This is early. This is when COVID was hitting, and we had to take our quick and decisive measures. We always had the in there that promotions, while exceptional, will still be happening. So just it's going to be, yeah. So while increases will happen, promotions will be far and few between for this year. Full stop.
Okay, last question. How do enrollment figures look for the fall compared to pre-COVID projections?
So, Tulane has never, ever been hotter. No question about it. We've got coming in the first year class, we've got the really the most selective, most diverse, most accomplished class we've ever seen. We admitted about 11% of the 44,000 applications because our yield once again skyrocketed. There's just no question that what you do on this campus, what the entire community does, is creates an academic environment which is really second to none. And you can see that in so many different ways, but you can see it in the students around the country who want to come here. You can see it in the students who want to come back to campus, our returning students. And so that, I think, underscores not only the value of what we do, but the importance of coming back on ground in mid-August. I want to thank everybody for being part of this. First of all, I want to thank all our expert panel, Patrick Norton, Shante Bolton, Jason Cretion, Kelly Venable Carroll, and Scott Timms. They've all been hard at work in part of 6 different committees, really focusing on how best to bring us back as a university. A lot of hard work. I encourage you to read the reports and the recommendations, but obviously this is part of an interactive process. Every institution in this society is doing this. We're doing it as a community with the help of experts in the field, but obviously this meeting, as well as others, are a way for us to get ideas and feedback about how best to bring everyone back. I want to just underscore once again my admiration for how the entire Tulane community has handled this. It's been a very difficult period, but in a sense, the move to working from home, teaching remotely, studying remotely went certainly as well as any school in the United States. And it was a testament to everybody who's part of the community and the staff. You really did an excellent job. And I think this process of thinking through how to come back and to make sure we do it in the best way possible, I think it's been, everybody's done a great job. I know there's still a lot to work through, but I want to underscore my thank you to you and my recognition that the Tulane community is second to none. And I've seen that during all my years here, but it's never been clearer than in a moment like this. So thank you all for being part of this. Stay safe, stay well, and I look forward to seeing everybody back on campus ultimately. Thank you all.